So a warm welcome to you from Geneva, Switzerland. And this Reach session, we're going to tell you more about it, but very quickly, it is about networking. And here we do ask you right at the start to check your audio, use a headset, look for the breakout room icon, because that's where the action is going to be happening. That's where you'll be going into breakout rooms. Get ready to introduce yourself and your organization. And remember to share your challenge, share your experience. That's what Reach is all about today, as we're counting down 14 days away from Teach to Reach 11, which will be held on December 5th, 2024. We start in the morning in Geneva, so depending on where you are in the world, it may be better or worse a time, or more or less of an inconvenience. All you need to do is to find the Teach to Reach page here, click on Request Your Invitation, fill in your details. And actually, even amongst the leaders of Teach to Reach, we've seen some people have not yet done this, so please go ahead and do this as soon as you can. Now, to come back to our Zoom studio, you're going to see, if you're on your phone, you'll see what's on the left. You'll see in the red square, we've really pointed out the breakout room icon, and this is where, when it's time to network, you'll click on breakout rooms and join one of the rooms. You may also be automatically assigned to the rooms. Now, to kick off, we'd like to ask you to tell us about a specific time when severe malaria affected someone close to you, your family member, a friend, or patient. What exactly happened? What did you do? And how did it turn out? Charlotte, a warm welcome to you. And we also have with us Maria Monzan, who just got off a plane I believe in Argentina, and is joining us as well. Charlotte, who shall we hear from in response to this? To respond to this question, tell us about a specific time when severe malaria affected someone close to you. What exactly happened? What did you do? How did it turn out?
Thank you so much, Freda. And once again, a warm welcome, everyone. So please just go ahead and raise your hand if you would like to answer that question. I know for most of us who are in malaria endemic zones, we have had loved ones, we have had patients that suffered from severe malaria. So please just go ahead, or I'm going to invite someone to be able to speak based on their own experience. And yeah, so okay, I see a Riskat Nasir. Your mic is unmuted. Okay, I see.
Okay.
Quickly,
Yeah, good afternoon.
Good afternoon, and please start by introducing yourself.
Yes, I am Riskat Nasir. I'm from Nigeria, Oyo State to be precise. I'm a retired nurse. That I love to say about my experience with the malaria, especially in this area. People refused to use the net, but there was a time because I retired at the Oyo State Hospitals Management Board, and we used to create awareness to give free treated mosquito net to people, but still they find it very difficult to use. So you see a lot of people dying with malaria. The temperature, when it happened to my own son, and is an HBSS, so he was in the university then, and he was just getting down with malaria every week. So not until I forced him to be using mosquito net. So thank you, but I don't always have malaria because I'm AS, so I don't have malaria. Thank you. I'm a retired nurse.
Thank you so much, Riskat Nasir.
Yeah.
Reda, you were saying?
Yes, thank you very much indeed. Now, you may be wondering why at Teach to Reach, where we started discussing immunization, why and how we came to this topic of malaria. And we're going to tell you all about that. We're going to explain that. But we're going to share with you what exactly is this Reach for Leaders. We especially want to warmly welcome those of you who are joining for the very first time. Reach is relate, engage, act, connect, and help. And really, we're offering special networking for health leaders at whatever level in your health system in your country. Whoever you are, if you work for health and you're willing to go above and beyond, Reach for Leaders is for you. One-on-one meetings, which is part of what we'll be doing today, and then really a dedicated communication channel. We had the the first Reach session on the 6th of November. And look at who came. First of all, 333 participants, 45 countries, and you can see almost 30% from the community level, but also more than a quarter from the national level. So really a healthy mix of people, health professionals from all across the health system. And the same, you can see that more than a quarter of the REACH participants are actually coming from government agencies, many of them local, but also national leaders, from civil society organizations, and again, from that community level. So before we go any further, we wanted to already begin to celebrate what it means to connect such a diverse group to each other and to be able to learn together, share together, make connections in line with the goals that our organizations have, but ultimately in line with the goals of the community. Now, as you know, as part of Teach to Reach, we're inviting organizations to join to become Teach to Reach partners. And this is where I'm pleased to say that we're going to introduce a number of organizations that have completed the partnership process, and then we'll introduce our global partner, RBM Partnership, to End Malaria. So these are the new Teach to Reach partners. Community Youth Development Foundation from Ghana, Liana Foundation from Indonesia, Kanko from Kenya, Luke Knight Limited from Nigeria, Citizens Health Education and Development Initiative, Nigerian Institute for Trypanosomiasis and Onchocerciasis Research, go. From PNG, from Papua New Guinea. Right, we do have a technical glitch here, which we hope to be able to fix. Please bear with us, and apologies to the organizations we're presenting today, but here they are. From PNG, Papua New Guinea Rural Women's Health Association. From Somalia, the Sanag Social Workers Organization. From Tanzania, the Tuwalinda for our health development. THD from Turkey, the Adana Metropolitan Municipality is joining us. From the Assistance Coordination Unit, from the ACU. From Uganda, Humanitarian Volunteers International are now Teach to Reach partners. The Reach Leadership Network Better Begins for Future. From Sri Lanka, from Nigeria, from Sri Lanka, the Research for Development Innovations Guarantee Limited. From Ukraine, the Academy of Family Medicine of Ukraine is now a Teach to Reach partner. On the Francophone side, from Benin, we have the Clinique Médicale Emmanuel. From Cameroon, Akesa. From Guinea, Malaria Youth Corps of Guinea. From the Democratic Republic of Congo, SADAFE, and the Réseau des Organisations des Jeunes Youth Organization, Fondation Femmes Plus, a women's organization. From DRC, the Fédération Internationale des Recherches en Communication pour le Développement et la Santé, le Centre Hospitalier de SIFA, SOS Hépatite, Synergie des femmes de la société civile, Women Hepatitis, a Hospital, Research and Communication for Development, Global Enviro Action, Centre de recherche agroécologique, le CRAE, l'Association d'entraide médico-sociale AEMS, le Réseau national des associations des femmes rurales, Rural Women's Association, the Hospital Center of Kavumu, the Health Center of Naima, the NGO Health Action, Health Community Action, and then ICTI, le Corps des Jeunes contre le paludisme, Malaria Youth Association from the DRC, and the PASMU. These are the organizations that we welcome today, starting today, to the Teach to Reach family. Many of their leaders have been participating for several, one or more Teach to Reach sessions, but whether you are new and this is your first time or not, I want to warmly welcome you. Many messages, and now we're going to introduce RBM. This is the partnership to end malaria. To end malaria, we must empower the people closest to the problem, health workers and affected communities. This partnership with the Geneva Learning Foundation allows us to listen to and learn from those on the front lines of malaria control, ensuring that their voices drive our global strategy. So with us is the partnership's officer, manager, Antonio Pizzuto from RBM Partnership to End Malaria. Antonio, a warm welcome to you. Can you tell us in one sentence what is RBM Partnership to End Malaria?
Hi, Reda. Hi, everybody. I'm glad to be here with you guys today. The RBM Partnership is a platform. It's a platform to connect all the malaria ecosystem towards a common goal, which is the final eradication of malaria.
That's perfect. All right. And can you tell us in your own words, what is this special event on malaria that we are organizing together?
Well, it's a unique opportunity for us to create skills for combating a more efficient fight against malaria, and we are very confident and happy to leverage the Teach to Reach platform for this purpose, because for us this Teach to Reach offers a unique platform to bridge gaps, foster learning, and mobilize action by connecting individuals and organizations which are passionate about health and education. We believe as RBM that together we have the opportunity to drive impactful change by equipping health workers, communities, practitioners, and policymakers with the tools and knowledge they need to fight malaria more effectively. Over to you, Reda.
Great. Thanks, Antonio. Now, just to explain how this works for anybody who has not yet requested their invitation for this special event, this will actually happen after Teach to Reach 11 on the Tuesday following Teach to Reach 11. So Teach to Reach 11 is on 5th and 6th of December. This is happening, as you can see, on the 10th of December, so on the following Tuesday. It's very simple. All you need to do to request your invitation is put your name here and then your email at, many of you seem to use Gmail, and then click on Send me my invitation. That's really all you need to do. If you'd like to know more about the partnership with RBM, you can find the information here on the RBM website, as well as on the Geneva Learning Foundation's LinkedIn page. And as you know, we'll do a practical activity to actually help amplify this event before we go any further. I do want to explain that we have shared the Teach to Reach questions. So I'd like to ask you, if you have answered one or more Teach to Reach questions, to type yes in the chat. And just a point of order for those of you we encourage organizational leaders to share their contact information and to really network and build your professional networks. That's what Reach is all about. But if you post your email or phone, we cannot show it on screen, just to explain for those of you who were wondering. So if you have answered Teach to Reach questions about malaria, please type yes. And I know some of you in the room, I have seen your answers, so please go ahead and type yes in the chat. We had two initial questions: share how malaria has impacted your life, your family, your community. And then we have a whole host of much more detailed questions. You can see 10 questions here, really on various aspects. And the same, if you're specifically involved in malaria vaccination, then we also had specific questions from you. Let's go to Manisha Danan. Dr. Manisha Danan, please, can you tell us, introduce yourself and tell us which Teach to Reach question did you answer and what did you share in terms of sharing your experience?
Good evening, sir. Hello, am I audible?
Yes, loud and clear.
Yeah, sir. I belong to Maharashtra, India. I would share my own family member's condition. He had meningitis, post malaria, and it was in dire emergency whether he would survive or not post that. But yeah, with God's grace, he is doing good now. The effect on brain before and after malaria, it's long term because it is hampering our meninges. So I feel it's very important that we prevent the disease rather than treating the disease. And this is what I wanted to share with everybody.
Thank you very much indeed. Now, for those of you, I actually see very few yeses in our studio. So if you have not answered these Teach to Reach questions, check your inbox. In particular, in some cases, they may have landed in spam because I know many of you are very diligent, committed, and engaged leaders. So if you do not recognize this message that actually announced the RBM partnership and included 3 action points for you to follow up on. Point 3, I don't know how visible it is actually says, follow this link to share how malaria has impacted your life, your family, and your community. So let's go to Bashir Abdullahi, who's also answered at least one Teach to Reach question. Bashir Abdullahi, I would love to hear from you. What did you share when you answered Teach to Reach question? And as a reminder, Teach to Reach questions are really the key mechanism for learning before Teach to Reach by sharing your experience. All right, Bashir's not answering, so let's go to Marian Mutange. And also, let's see, Noor Douglas. Yes, Bashir Abdullahi.
Hello, sir.
A warm welcome to you. Do introduce yourself. Tell us how you've been participating in Teach to Reach, and what did you say in your answer to the Teach to Reach questions that you received by email as a Teach to Reach participant and a health leader in the Reach network? Oh, we just lost Bashir Abdullahi. Seems to have lost his connectivity. I see Hanvir Bahati. And let me see, we'll try Noor Douglas. If you're not participating in the Teach to Reach questions as a leader, we really ask that you lead by example, show your commitment. I'm trying Noor Douglas as well, who said that, Noor said that they answered a Teach to Reach question about malaria. We're going to show you this is the power of peer learning by answering these questions. You just click on the link, share your experience, and then we'll be sharing everyone's experiences together. All right, it looks like we're having between the technical issues and we're actually not able to hear from anyone about these Teach to Reach questions. We're going to go into networking. It's very important that you check your audio and use a headset because we are going to put you into breakout rooms and you're going to be able to introduce yourself and your organization. And this is really the key to the Reach network sessions ahead of Teach to Reach. Introduce yourself, your organization, share a challenge, share an experience. And this time, unlike the first session, we're going to focus on specific questions and ask you to discuss those in the breakout room. We'll be asking you after the event to report back on what you learned and what insights you gained to share how these sessions actually help you. So do keep that in mind as well. We'd like to, in the first Reach networking session, we invite you to tell us about or to share with your colleagues when severe malaria affected someone close to you. Now, for those of you who do not work in malaria, you can also discuss questions around primary healthcare and service integration, the community connection. Tell us about a time you saw signs of malaria during your regular work with families, service integration. When have you talked about malaria? During vaccination, as many of you work in EPI or other health visits. And then also collaboration. If you can think of a time you worked with malaria staff to help a family. So is there anyone who'd like to respond to one or more of those questions? Noor Douglas, are you there? Are you able to speak to us now? All right. And you will only be able to participate in the Reach sessions if your equipment is working properly. And it's a very big disappointment in some cases because someone will actually make the effort to really participate. And then the other person hasn't checked their microphone or hasn't checked their connectivity and is unable to participate. So we hope that everyone will make the effort today. Yes, let's go to Adamu Dagona. Adamu, a warm welcome to you. Do introduce yourself and tell us either you can share a personal experience about when severe malaria affected someone close to you, or really address these any of these issues around primary healthcare and service integration.
Yeah, I'm first Adamu Galadima Dagona from Nigeria, specifically from Federal Investigation. So, in fact, from the northeastern Nigeria, the malaria is causing a devastating kind of a problem that affects almost 90 to 80% of the families in around that. So, therefore, the side of the malaria is devastating. The high fever, the headache, shivering, and many other aspects have affected the lives of the family, which are regularly sometimes high fever.
So, Adamu, these are general considerations, and while they're helpful, what we want to know is your actual personal experience, your professional experience around these issues. Can you tell us, can you think of a situation, tell us about a specific case or situation in which you were confronted with issues around malaria? If you're immunization staff, and I believe you are, around that community connection or collaboration, that's what we're most interested in, rather than generalities.
In fact, since we are just living with them, and in fact, I'm from academia, and all the way, I have not engaged mostly during the immunization exercise and others, but I used to sit down with them. Most especially, I'm a microbiologist, so sometimes when they reported the cases, so they need to be referred for making some of the tests from there. By then, we can make a diagnosis. Then they can just recommend a drug for them in order to have some of the things.
Great. Thank you, Adamu Dagona. Let's go to Kingsley Ninyeri. Before we go into the networking, Kingsley, would love to hear from you, and I hope you are well and your connectivity is well too, so that we'll be able to hear from you. What would you like to share with the group before we go into small groups to then share experience on these questions around malaria?
Thank you very much, Rida, for giving me this opportunity. I'm Kingsley Ninyeri. I work with Community Youth Development Foundation, Kintampo, in Ghana, West Africa. Yes, malaria is doing more harm than good. Malaria has had a lot of impact on me, my family, and my community. We've wasted a lot of money in treating for malaria medication. Anytime we had malaria, we always go to the health facility, and at times the medication will be prescribed for us to go to the pharmacy and buy. Other times we will go to pharmacy to go and buy. So we have actually wasted money and time in terms of malaria medication. So if you are talking about malaria impact on me and my family, I wouldn't hesitate to say it has had a lot of impact on me and my family. Children are dying out of malaria. Pregnant women are losing their pregnancy because of malaria. Convulsion. Children are suffering from it because of malaria. So malaria indeed is doing more harm than good, especially in the rainy season, when there is severe downpours of rains and gutters are choked, mosquitoes are breeded there, and they make good use of the people. And also more OPD cases are recorded because of malaria. And at times, test kits, RDTs, that we can even use to test for malaria to know our status before medication. At times you go and they will tell you that there's no RDT test. So how do we even treat malaria? So malaria is actually doing more harm than good. Thank you, and I'm over.
Thank you, Kingsley. I can hear there's a lot of experience there, and I hope that in responding, can I ask you, did you respond to the Teach to Reach questions?
Yes, Rida.
Okay, of course you did. All right, wonderful. Let's go to, all right, we're going to we're at the 24-minute mark. We haven't yet experienced the core of the Reach session, which is the networking. So we're going to do that now. But before we do, I'm very pleased to be able to introduce a special guest. You'll be hearing a lot more from her, hopefully next week at next week's Reach session. She is Dr. Joanna Sanchez, and she is from the organization called Grand Challenges Canada. Joanna, I know it's early in the morning for you. You're based in Canada. Would love to hear from you and have you briefly introduce yourself and GCC and explain why and how you are working with the Geneva Learning Foundation and contributing to this upcoming Teach to Reach 11.
Thanks, Reda. Yeah, happy to. So I'm actually calling in from Central America. So greetings from El Salvador, everyone. Yeah, happy to be here to say hello, and you'll hear more from me next week. But essentially, yes, I'm Joanna Sanchez. I represent Grand Challenges Canada, who is based in Canada, obviously by our name, but we are an innovation funder, primarily funded by the Government of Canada. And we are developing a climate and health funding program. So we already have existing work in global health and humanitarian work, and now we're moving into the climate and health space. And so we are partnering with the Geneva Learning Foundation to learn from the health community, including healthcare workers. What are the biggest challenges that are currently being experienced in the climate and health space? What are the biggest priorities in terms of health? And so we hope to engage you all in this climate and health space. And we know it's an increasingly important topic that is coming up as a priority all over the world. And so we're hoping that with these findings and the launch of a global survey, we can provide a much needed, fill a gap that is much needed all over the world for all funders, organizations, anybody working in the health space, really, and in the areas that are most impacted by climate and health, by climate. And so looking forward to talking to you more about that and sharing more about what Grand Challenges Canada is and the future funding opportunity that we hope to put together. But more importantly, we hope to provide the world with some answers to these questions in terms of like, what are the biggest challenges we're seeing in the climate and health space. So great to be here and looking forward to chatting more next week.
Wonderful, Joanna Sanchez. Thank you. And as today's session is specifically for organizational leaders, I'm sure that Grand Challenges' future interest in supporting action to respond to climate change impacts on health is going to receive a lot of attention from this particular group. Now, back to networking. Check your audio. You're really missing out if you don't take the care to make sure that your headset, it's better to use a headset, is working properly. We're going to go now into the breakout rooms. So, and we're going to do a first round of 5 minutes just so you can get a taste of how it works. We have many new people joining this Reach session for the very first time. We want to warmly welcome you to the Teach to Reach. All right, so here we go for our first 5-minute round. We'll keep you in the same groups unless you end up in a group where no one is speaking. Let us know if that's the case. See you in 5 minutes. Now, for those of you who are not being moved automatically to the rooms, in that case, this is probably because the most likely cause is because you have used a very old version of Zoom. This may be limited by your device. So we want to make sure that's, all right, I see the room is emptying slowly but surely. We still have many people in the plenary. Let me just make sure, yes, everyone is assigned. So you should find yourself in a room with individuals here. For those of you who are not being moved, look for the breakout rooms icon so you can see it up on the screen. It's the little square. If you're on your phone, you should be seeing what you see on the left of the slide. Look for the little breakout room that's in this in the red square, and then click on breakout rooms and join your room. For those of you who haven't joined yet, we are able to ask you to join, but it's a manual process. And for those of you who are here with us in the room, well, we're going to look at actually the next question, which is think of a particular moment when you could not get malaria medicines or tests when you needed them. Can you walk us through what happened? So we're going to lower everyone's hands. And for those of you, there still seem to be a lot of people who have not moved to their rooms. Charlotte, so we're going to ask you to raise your hand, and we'll be opening up your microphone so that you can stay in the plenary and still benefit from this Reach session, even if, and then the recommendation is to make sure that you upgrade your version of Zoom so that you're able to fully participate. So the question that we would like the message in the rooms to consider is here, but actually I suggest we go to the next question. If you can think of a particular moment, so this is as a health worker, you could not get malaria medicines or tests for individuals in need. If you'd like to share a story around that, please raise your hand. And then this issue of access to treatment, we really are interested in hearing your experience. What's your biggest challenge in getting malaria medicines to people who need them? How do you handle it when supplies run low? What clever solutions have you found that others might use? So if you'd like to come in on any of these issues, please raise your hand. We know that many of you are directly involved. I'm just going to, if you see the prompt to talk, you still need to raise your hand so that we know you actually have something to say. And then Charlotte, you shared something. Is this your personal experience or are you sharing someone else's?
That's my personal experience, Reda. I just thought maybe the question was around severe malaria, because for those who are in endemic zones, like simple malaria is something that is very common. It's almost like a day-to-day. Like currently, there's a member of my family that is taking treatment for malaria. I say I'm speaking to you, but severe malaria is something that is quite remarkable because the way it manifests and how it really affects the person that is sick is something that you hardly forget, and it's really memorable. And I thought I should share the most recent experience that I had with my 12-year-old son. That was September this year. Yeah.
All right. Thank you, Charlotte. Really showing us how and also the value of sharing your experience, but exactly how to do it. Not everyone is familiar with this, but this is about your actual experience. There's around 30 people who are left in the room, and everyone else is coming back in about 60 seconds. Not sure why. I know that there's many of you have that experience with these questions around access and treatment. So please do either unmute yourself or raise your hand so we can come to you within a few seconds. That we'll have everyone else coming back into the main plenary. And if you have not been taken to your breakout room, that is unfortunate. It is primarily because it is likely to be because you are using an old version of Zoom. Really, that you'll get the most out of the experience of participating in these Reach sessions and also Teach to Reach itself if you have updated Zoom. And all right, and what Rebecca Bellows says is fine. She says, I do not have a challenge with malaria treatment or test. However, I will listen to other colleagues and it might help someone close. That's exactly the spirit of Teach to Reach. All right, everyone's coming back in now. And
yeah, and rather concerning the question of access and treatment, I would really like to invite, if you are a community health worker that is involved in community-based diagnosis and treatment of malaria, essentially using RDTs and ACTs, that is the rapid diagnostic test, and the artesunate treatments, you could share your experience if you have had issues with accessing with stock outs. This is the opportunity. We really want to hear you talk about that.
All right, Adamu, we have to know what was amazing about Group 3. You said it was amazing. Can you tell us more? Please do unmute yourself. We'd love to hear from you. And then we're going to ask yes, please go ahead, Adamu. Who did you meet?
Because when we break up, we discuss about some of the experience that I had. And I have the opportunity in order to join one of the research team from the academia, from the universities that carry out the surveillance study on mosquito vectors in northern Nigeria. So therefore, whenever we went to the field, mostly we find people just coming to us, just trying to ask, what are we doing? Then we say that we are trying to see how we will reduce the menace of the mosquito to them. So therefore, that people love to see the people going there. They are saying that they are suffering, but they have been challenging the malaria kind of menace. The children, mostly they're affected. So therefore, they love to see that this surveillance study is being carried out in order to reduce the burden of the mosquito vector that is breeding around their area. So therefore, we have shed more light and rub our own minds in order to see that how we can going to help to reduce the menace of the mosquito vector around the area.
All right, that still sounds very general rather than specific experiences. So I really encourage every participant, when you share, think about things that no one else can know. You know because you were there and you actually did things that, and you can share how it turned out. But thank you for sharing, Adamu, and I'm glad it's a positive experience. Let's go to Safianu Haruna, who says, Safianu says, the biggest problem regarding malaria treatment is access to quality malaria drugs. So that gets a little bit to the access and treatment issue. Can you tell us, Safianu, do introduce yourself and tell us if you were able to participate in the networking session. Tell us what your experience was there and why you say this is the biggest problem for you.
Hello, good afternoon, everyone. My name is Safianu Haruna from Kano, Nigeria. So the issue is that there are many malaria treatment drugs available in the market. But the issue is the quality drugs, because you may find someone taking malaria treatment but still having the malaria. That is one. And the second is the supply chain. You may find that at most, you may find that many companies that producing these drugs, at the beginning, they may produce the quality one, but subsequently you may find this drug are substandard, because I have been seeing there are certain research taking place. They found that among 100 malaria drugs, only about 99% of that drugs that have been analyzed, they are found they are substandard. Thank you so much. And over.
Thank you very much indeed. Some very interesting contributions also being shared in the chat, as you can see on screen. Hashim Ibrahim Bello says, our biggest challenge to reach people with medicine in Northwest Nigeria is insecurity. Dr. Tusimi Ramadan says, very good questions about malaria. Let us share the information with others to fight malaria. Professor Bakitagbo says, one challenge is resistance and the cost of malaria. Now, we're going to go into one more session. This time it's going to be 10 minutes, and we're going to allow you to choose a room. So the procedure is going to be a little bit different. Let me open up all the rooms here, and you'll have 10 minutes to network this time. Here we go. Now, this time, you do get to choose what room you want to go to. So you can go back to the group you were with, or you can try a new group. What you do is you look for the little breakout rooms icon and click on that. And then you should see the options to access the rooms. You can go back to the same room to meet the same people and continue the discussion, or you can stay. You can choose a new room. All right, and when we come back, we'll ask you to share what you learned by meeting, networking, and learning with fellow health leaders in these small groups. And for those of us who are still in the room here, we're going to go look at the next question. And again, if you missed this email, you can see on the left what it looks like. Check your inbox, check your spam as well. Make sure that our emails are marked not spam. Otherwise, you're really missing out on the best part of the Teach to Reach experience. We asked you to share how malaria has impacted your life, your family, your community by Sunday, and then how changes in climate and adverse weather have affected malaria in your community. So these are important questions. There's also 10 more questions to share for deeper sharing of experience. And remember, our commitment is, of course, that if you take the time to answer in writing, you'll be the first to receive the experiences shared through Teach to Reach. So you'll get to see what everyone else has shared, and that is key to the peer learning process at work through Teach to Reach. So we now go to the next topic for those of you who are still with us in plenary. So Ebenezer highlights a very big challenge in Ghana concerning malaria is lack of education. And then Peter Achin from Nigeria says inadequate quality anti-malaria drugs. Now, I know that there was a correction that Charlotte gave me for this particular slide to add, and I think it was, rather than a case that you will never forget, what do you do in your work? So think about this question to ensure that pregnant women do not get malaria. So really focused on prevention first, but then also for those of you who have that clinical experience of caring for pregnant women, if you are in the room with us and not in one of the breakouts, then please do raise your hand. If you'd like to say what you do with respect to prevention, please say that as tell us about that as well.
Thanks, Reda. And I see an interesting comment from Rebecca Bello in the chat. Say, if my community will distribute nets and carry out tests for under 5 and pregnant women. However, people do not want to use the mosquito net. So we have seen that kind of situation in my context in Cameroon as well, where mosquito nets that are given to pregnant women, they put them in their boxes and store them until when they have their children, instead of using them to help prevent them from getting malaria. So I don't know if you have had that kind of an experience as well in your context. Please do share.
And Rebecca, if you'd like to tell us more about that, what specifically the challenges were. I see Tafuro there also has her microphone unmuted. Tafuro there, would love to hear from you on any of the issues we've discussed so far with respect to malaria. Really what things from your direct experience, things you've actually done, carried out, seen with your own eyes, that is what we're most interested in, as you well know.
Hello?
Yes, we hear you loud and clear. Absolutely.
Thank you for giving me this opportunity. Mostly in my community, what we do with the pregnant mothers, we make sure they are not affected with malaria, because when they are affected, it is not easy to treat them because it is dangerous. The medication might affect the babies they are carrying. So we make sure they go for clinic at an early stage to make sure they have been diagnosed, and if they are having malaria, they get a way to treat them, because it is not easy. And again, people with malaria, when they go to the facility, if there are no medication, they write the note for them to go and buy in the chemist, and yet they don't have money. So it is not easy for the community to get treated if they are having malaria. Though in my area, it is a free zone malaria, but when people go to up country, they come with that virus, and it might affect all the community, the whole community, because there are places where they stay, they are not conducive for them. Thank you.
Thank you very much indeed, Tafaroda. Nezan Gadiadza, your mic is unmuted. A warm welcome to you. Tell us if you've participated in Teach to Reach before, and then tell us what experience that is yours, things you actually did that you saw that you'd like to share with us. We'd love to hear from you.
Thank you very much. My name is Naison Gajgadza from Harare, Zimbabwe. Yes, when we talk about pregnant women, surely it's a really pathetic situation, especially in my country, where first timers, by this I mean those who fall pregnant for the first time, and especially those who have unwanted pregnancies. It's very, very rare for them to know that they are pregnant, and they are prone to malaria because of the circumstances they would be going through. This I witnessed in my community, where my own nephews, nieces also had pregnancies which were not wanted. So number one, they wanted to hide the pregnancy itself, and in terms sleep away from other people to avoid being noticed, and that's when they fall prone to malaria. And during that malaria infection, they might not come out exactly for diagnosis. And because we are there to help each other in the society, we then ask and plead with those in authority to try and accommodate the young women's plea of having a pregnancy out of marriage, of which is a taboo in my country for a woman to have a pregnancy without a husband, a known husband for that matter. So you really, because of such issues, we need now to come together as families, as friends, as community, to try and advise the young women that whenever such a situation happens, please get tested for malaria. Don't quickly think it's an infection affected that has been prompted by being pregnant, but maybe also malaria has crept in. Thank you very much.
Thank you very much indeed. Let me see. Let me check. Okay, Patience. Ajay, you have your hand raised. Patience, please go ahead. And then let me see if there are any other hand raised. We've got 2 minutes to go before the health leaders who went to the breakout rooms come back, return to the plenary. Patience, would love to hear from you, asking you to unmute as your hand is raised. If there are others who'd like to speak, you can see there are 3 more questions on pregnancy and malaria. What works best when supporting pregnant women with malaria? Patience, your microphone seems to be unmuted. We'd love to hear from you.
Yeah, well done, everybody. Am I heard?
Loud and clear.
Good afternoon and evening. Yes. A happy Malaria from Nigeria. My name is Patience. I work with WHO. Thank you, sir. In helping these pregnant women, we usually at the antenatal give them the real health talk and tell them the causes and how they can prevent this malaria. For the mosquito net, majority of them, mostly those who don't come to hospital regularly, they use it to do their fish ponds. Some of them use it to do their vegetables. They use it for farming and for other things instead of using it for themselves. But at antenatal level, we try to make them understand the importance of not having malaria in pregnancy, because a lot of complications come. Some might have their baby before preterm delivery. Some might have miscarriage because of mosquito and the malaria that it causes them. Some of them, majority of them, they might go anemic. So by the time we give them this health talk, they now come down to use their mosquito nets. And home visit is also helping us very much. We visit them at the communities once in a while to see what they are doing. We do follow up. Our trackers, women that mobilizes them house to house, we use them to track these pregnant women until delivery. And after delivery also, we ensure that they and their babies continue sleeping under the nets to prevent malaria from mosquito bites. Thank you very much.
Thank you very much indeed.
Yes, sir.
We've got all the participants, health leaders from the Reach for Leaders initiative. That's Relate, Engage, Act, Connect, and Help. We're now coming back into the plenary session. They've been working in small groups, sharing around these issues, while those of us who stayed in the plenary were doing the same. Almost everyone is back. We've got a few more seconds. The breakout rooms will close in about 10 seconds. I do want to tell you a little bit more about Reach for Leaders, and we do have a practical activity that we'd like everyone to be involved with. So just give it a second. And here I'd like to ask you, there's been a lot of sharing, a lot of experiences shared. Really appreciate the sharing. We do ask you to mute. This is Reach for Leaders ahead of Teach to Reach 11. Teach to Reach is part of this continuum from from knowledge to impact, different interventions. As you know, at Teach to Reach 10, there was a remarkable number of participants already, 21,398. We're now 14 days away from Teach to Reach 11, and an amazing 23,944 participants have joined, registered for Teach to Reach 11. Today, we are together for Reach for Leaders, which is a session specifically dedicated for leaders of health organizations at any level, anywhere. We offer special networking for leaders. That's what we're doing today. One-to-one meetings and a dedicated communication channel. Last time, actually the first session of Reach on the 6th of November, 333 participants, 45 countries. Absolutely amazing. We welcomed a number of new partners, and we do encourage you to involve staff, volunteers, community members, beneficiaries, caregivers in Teach to Reach. Everyone is welcome. Pay attention to the Teach to Reach questions. This is where we dig into the issues. Now, we've just come back with the Reach leaders who've been networking. So we want to do a final call, as we have about 5 minutes left in this session, for those of you who'd like to share what you shared and learned in your room. So please do raise your hand or unmute your microphone if it's already unmuted. We see many of you. If you've been able to participate in the networking, please do raise your hand this session, the reason we do this, and tell us what happened for you during these sessions.
All right, my name is Mr. Ndoka. I was in group 6. I don't know if I'm being heard.
Yes, loud and clear.
My name is Mr. Ndoka. My name is Ndoka. I'm in group 6. We shared experiences, and most of the experiences we shared tends to lack of malaria commodities, drugs, and RDTs. In one of the participants said that sometimes when somebody is presented with malaria symptoms and then they do RDT tests, there is no sign. It doesn't pick up the PF, Plasmodium falciparum, but the person is still having symptoms. And so in the facility, they ask you to go home without treating you. But when you do further investigation with microscopy, you find out that the person has malaria. And before then, that means there's a delayed treatment, and that means it could be dangerous. So it's either the RDT did not work very well or it is not effective. And others also talked about free malaria that was supposed to be given to people free of charge, and then they did not get it free of charge. It has to be paid for at a very critical time when the children wanted it. They don't get it free of charge. But then the big question we ask in our group is, can malaria be ended? Is it possible that we end malaria? Or maybe we can still control it, because there are so many things that need to be put in place to end malaria. Is it possible that malaria will be ended, especially now that a lot of journey with climate change issues, and then funding strengths, funding restrictions, and the fact that some of the government don't even have they don't even have budget for malaria interventions. They only depend on foreign donors and international funders. Can we still end malaria? Thank you.
Thank you very much indeed. Now, unfortunately, we're out of time. We see many hands raised. We do have one last practical activity, and I must say this is a very impressive group. For those of you who are there on 6th of November, you should recall what to do. I'm going to share the link to share here, and let me see if I can actually do a little bit better than that. Please go to this link, so click on it. You should be able to stay in Zoom without losing the connection. These are quick and impactful steps. So there are really 3 things that we're going to ask you to do. Just give me 1 second so I can actually show you what these steps are. And if you found this session useful, the time has come to share with your colleagues. You can, of course, share on WhatsApp, but I'd like to ask you to go to this link, and you can see I'm doing it here. Let me share and we're going to ask you to share this. Comments about why this is worth joining. So we're going to do here. the 3 impactful steps. So let me know if you are actually on the LinkedIn page. We'll also share the links for the other platforms. So if you are on Facebook, you can see that's the 3rd link. If you use Twitter or X, if you use WhatsApp, I suggest you just copy and paste, and make sure you copy and paste the links. And so 3 things I'd like you to do. The first one is a like. So it really 3 clicks. The second one is repost. Okay. You can see I just got a successful repost. You should be able to stay connected to Zoom while you do this. And then the last part is the only one that is the only step that requires you to type, and that is just to leave a comment. I highly recommend this to, and then you can actually tag someone. So I'm going to tag Charlotte here and make that comment. So once you've done this, come back to the chat in Zoom and type yes into the chat. Once you've been able to do this, I'll show you how this works for the other. So the quick impactful steps I'm going to post again in the in here, and then again you have the other platforms. All right, Riskat Nasir, thank you. Let's go to see if anyone has posted on X or Twitter, formerly known as Twitter. Let me see here. And right now we have only 11 views, and it looks like nobody has posted here. I know some of you are quite active on Facebook. Thank you, Adamu Atiku and Mario Chatsi Damianos. Apologies for Janada Dimas. Thank you. And we're going to go check in a couple of seconds. We can see here on Facebook, Endayo Iwat, Linda Sibilla, Rixat, Toyosi Nasir, Honorable Ifi Mercy Nwanko. Thank you for taking the care to do this. We're going to reload the page here. Actually, this is the French. Let me reload here. And let's see. And this is important because this will bring this initiative to the attention of your colleagues. Okay, this is pretty amazing. We've just got 23. We went from pretty much 0 to 23 likes, 13 comments, and 12 reposts. Remember, even if it's no more clicks to actually repost, and that makes your network far more likely to see it. I'd like to thank Joyce Mariti, Maria Fernanda Monzan, Fanny Ogu, Professor Ambassador Bakitagbo Mochirula Fasiku, Jesuki Wale Adeniji, Dr. Manisha Danan, Usman Mohammed Tukur, too many to name here. This is how we end because we have to start the session for the French, for the Francophones. Thank you very much indeed for this session. We'll see you in 1 week for the next Reach session. Invite your colleagues, help us grow this network. The more you share, the more we can learn from each other. Once again, thank you and take care.